Good morning, ladies and gentlemen. A very warm welcome. Let me introduce our experts. Madam Dorota Pawłowska, a Director of Medical Centers Harmonia, Martyna Zagajewska, a psychologist and an ICC coach, and Dr. Tomasz Kowalczyk, a psychiatrist. They all work at Harmonia Mental Health Clinic, which is part of the LUX Med group. Ladies and gentlemen, our brief session will be conducted in a form of an interview. It will be quite a natural thing for us because we have never met in person, even though we have been cooperating in key projects of our group for a number of months. Well, this is the pandemic times. In the Lancet Psychiatry, we had a recent and very concerning publication of a report from a study on 3,000 patients, and these patients suffer from phobia, sleeplessness, and depression. And the previous mental health problems are a risk factor for COVID-19. So I would like to ask our partners what activities can be undertaken from the point of view of mental health care. Well, indeed, even the general population during the times of lockdown, self-isolation, and remote work requires assistance, and we adapted to these needs. We prepared remote solutions, and during the first phase of the pandemic, we offered 9,000 consultations for our patients that were performed online. And now during the second wave, 14,000 of such consultations were given online, and that was almost 40% of all the consultations given. We have more and more demand for such consultations, for such help, and we have a conflict here. On one hand, we have patients who need assistance, and then we also have the requirements of isolation. We have fear of infection, so people are not so inclined to visit clinics. So we decided to support telemedicine solutions. It didn't all happen at once. We had 4 different stages, and at each stage, decisions were required. First, we offered consultation over the telephone, then video consultations, and then video consultations often for the first time visits. And we had to organize all this in compliance with the guidelines of Polish Society of Psychiatry. We decided to develop these services, to specialize in these services, and this is how we created Virtual Harmonia. We built a new telemedic platform. So that's a general picture. And let me now give an opportunity to Martyna Zagajewska and Mr. Tomasz Kowalczyk, who are specialists that work with these solutions on a daily basis, offering assistance to their clients. Good morning, ladies and gentlemen. In my opinion, majority of patients approached telemedicine with flexibility and openness early during the pandemic. Some of them were skeptical about this new formula. In particular, I am referring to patients suffering from different types of phobias. However, as time went by, many patients started to appreciate telemedicine and remote consultations. This includes teenagers for whom such online contacts are a natural form of communication. So we have decided to be proactive. We support one another and help one another. We can offer comprehensive mental assistance to patients from all over Poland. Patients are no longer so inclined to cancel visits due to logistic problems. And my work with patients during the pandemic shows that crisis situations are more frequent during the pandemic, and this requires us to adapt and to improve our services. An added value of telemedicine is certainly the possibility to gather new experiences. The disadvantage is a lack of personal contact. We have limited possibilities of observing the gestures, the body language, and this limits our diagnostic capabilities. We have to encourage patients to use online video consultations. However, not all patients have access to such tools, and some of them are not willing to use these tools. So we have a challenge of preparing a user-friendly, easy tool. I remember a consultation with a patient who lives quite far away from Warsaw, and regardless of the distance, I was able to offer him a therapy that would cure him of his addictions. This form turned out to be the right one for this particular patient. More and more patients appreciate this form of therapy, even if they are over the age of 60. Sometimes they have lack of experience of the previous use of modern technologies. However, they are trying to use the holistic assistance of our specialists.
Well, I remember early this year, we were anxious that we'll have to start working. And in late March, I had a patient who asked me to speak to her over the intercom because she was afraid of the infection. So I noticed that people living in distant places were keener to have remote consultations. They started posting their opinions online. We were able to have a conversation, very safe conditions, and there is no need to commute. If the patient wants to cancel a meeting, this is much easier. And for example, while the lockdown lasted, this was the only option, which is now very frequently used. For example, with quarantined patients, lack of waiting room is very positive. But on the other hand, when you have other household members around you, very often you avoid difficult topics. Sometimes I can hear that my patients are sitting inside their cars. There is also a risk when the patient is discharged from the hospital that you will not see the patient again. Another challenge, and of course there are practical tests conducted with patients. There are self-assessments that can be performed by patients, and this can open up brand new possibilities for us. Well, thank you very much. I'm very impressed that you have gained so much experience. It's a brand new channel, remote channel, which has not been offered before the pandemic. So do you think this experience is affecting the image of the company? Yes, I'm certain, because implementation has moved us forward to a whole different level. We are expanding our range of services, also those for patients. And we're introducing brand new solutions because we have teleconsultations and we have a whole range of different consultations. We have webinars, we have chats, and we have technology hotlines. So to sum up, we are very driven to grow, and we are keeping our fingers crossed because we know that those new solutions may benefit our patients. Thank you. Well, thank you very much. As we can see, telemedicine is gaining momentum. Even in such fragile area like mental health, it brings benefits. And such remote care will be further developed, and I'm sure new technologies will be added soon. And in this case, e-health is very often referred to as e-mental health. Thank you very much, and over to the studio.